Yeah,
Just
he
one of my
said that
fellows.
he was gonna go procure
Cure,
the,
yeah.
the lungs.
So your donor is what's called a DCD, donation after cardiac death.
Uh-huh.
So what would happen is when we go to the donor hospital, okay, they put the patient's in the intensive care unit there, okay?
All right.
They withdraw life support from the patient, okay? And then there's a period where we have to wait and watch and see and make sure the patient passes away. There are times that we go out and look at these donors and the donor doesn't actually pass away in a period of time that's acceptable.
Right.
So that period of time is roughly an hour, okay? And we look at, and if the patient's had a very, very low blood pressure for a long time, that's also indication that we wouldn't proceed forward with it if the patient didn't pass away. So that's one of the things. If the patient passes away, then we move right ahead, we proceed forward, okay?
So the lungs are still viable even after an hour?
Yeah.
After removal? That's it.
Yep. As long as the blood pressure hasn't been rock bottom and lungs are absolutely viable. Yeah.
Okay.
It's called just a different form of donor called donation after cardiac death versus the other type of donor we use, which is a little bit more common. It's called brain dead donor. So the patient's already been declared brain dead by at the hospital that they're in. They're taken to the operating room and we just go ahead and do the procedure because they're already declared brain dead.
Okay.
These patients, your donor is actually not brain dead, but has no further quality of life. It just can't be declared brain dead. So it'll be a withdrawal of life support. The patient's surviving on life support. It'll be a withdrawal of life support, and if the patient passes away, it's brought into the operating room, and the retrieval of the organs is performed. Okay. On paper, the lungs look good. It's a good donor, young donor. Looks good on paper. Yep. But that's just the only thing we can't always predict it.
Is it local or is it flying in?
We always fly, I would say, just to increase. So it's not far. It's in this state. I can't really give you too much.
No, I understand.
I wish I could.
No, but the reason I asked is probably what you're going to say. If it was local in Southern California, you've got more competition with the other hospitals, right?
Yes and no. It all depends on blood types, heights, weights, blood types, and then what your score is. Your score is roughly around 40, so your score is not at the bottom of the list. In your blood, what are you, blood type B?
AB.
AB.
Yeah, so you have a great blood type, so you actually show up higher on the list.
Right.
So that's why you're in a good situation because of that. So we probably wouldn't have got this donor if, say you were blood type O. There've been way more O blood types who have higher scores that probably would have gotten a donor. But because your blood type's a more rare blood type, but when it shows up, there's not too many people in that group having an AB, so you can pretty much get anything.
So, I guess everything is different, but like on a cardiac arrest type of a patient, so he didn't die right away, like with a normal heart attack?
Which patient? You talking about a donor? In
Yeah,
so
a DCD is what you
DCD,
said?
donation after cardiac death. The patient, it could be anything that has caused them to be in a critical state. So it could be a trauma, it could be a motor vehicle crash of some sort, and they could have had a stroke. They could have had a drug overdose. They could have all sorts of.
So it's not just a heart attack.
Mm-mm.
Oh, okay, I misunderstood. Because I thought usually with a heart attack, if you
No, it's not a heart attack. Sometimes the patients have a heart attack as a consequence of maybe a horrible brain aneurysm burst or horrible stroke. Their body's under such stress they do have a heart attack. But no, it's not your donor is not someone who's had a heart attack, and sometimes that would be easier actually, because when you take off life support, their heart's not going to work at all. But it's your donor is not.
That was my question. I thought
Yeah, no.
Okay.
Unfortunately, sometimes these patients pretty strong and resilient. Even though you remove life support, they still hold on for a while.
Is it possible that she could hold on too long, and then the lungs wouldn't be good anymore?
That's right. Yeah, that happens sometimes.
So what's the length of time?
So usually we'll wait up to an hour. Up to an hour, they're meeting our threshold. We look at blood pressure, we look at oxygen saturation, we look at a whole bunch of stuff. And we let it go up to an hour.
But that person has to be breathing on their own, right?
So they're they're actually on a ventilator. All these patients are on ventilators. We actually remove them from the ventilator, remove the medication that's getting their heart to squeeze and increasing their blood pressure. Everything is removed from the patient, and then it's a matter of you literally watch them. The intensive care team there watches and sees what happens, and if there's a period where their heart stops, there's a period we wait, make sure it stopped, and then when we declare that time's up, and then then the clock starts. We immediately, if that happens that fast, it's great. We go to the operating room and immediately get to work. Sometimes that period where you remove all the life support, the patient will sit with a normal blood pressure for a half hour and still breathing on their own a little bit, maintaining enough oxygen to their body. So it's hard to predict sometimes.
So this person hasn't been taken off of the life support yet?
No, not yet. It's actually a very coordinated thing.
Oh, I bet.
It'll happen probably in a couple hours, around a time where you're going to the operating room.
Okay.
We won't put you to sleep. What we do is we put our anesthesiologist will put one catheter in your wrist that measures the blood pressure, and then kind of just wait there until we give the word, until everything's good to go. Because we don't like to put patients with lung disease on the ventilator prematurely, because it makes everything difficult. So we won't put you to sleep until we pretty much know the lungs are good. And then if the lungs are good, you go to sleep, and then we get working. My partner and I. Did you meet Dr. Caterino before?
Yes.
Yeah.
Nice guy.
Yeah. So he and I, we do these double lung transplants together because it's a lot of work, and so he does one side, I do one side, and we kind of help each other out. So he'll be in tonight, and we'll do your lung transplant. That's our goal.
Great.
And we try to use small incisions. Okay, small. Usually don't split the chest in full, which is called a clamshell incision. We try to do these smaller incisions on each side like this.
Right.
But you'll have 2 tubes coming out on each side. Catheter, breathing tube, IV lines, all that sort of stuff, all standard.
Yeah.
And the goal is to get if your lungs are working good, your heart's doing fine, your brain's working well, everything's going good. We try to get that breathing tube out of you even tomorrow or the day after that.
Yeah.
And then we try to get you up, moving around, walking. And that's it. And we just start day by day, just taking care of you.
All right.
Moving tubes, moving this or moving that. Hopefully things, got my fingers crossed that the lungs,
Okay. Me too.
the donor passes, and then we get to work and do your transplant.
Yeah.
I can't remember the guy's name that went to procure it.
Phil?
Phil, would he know if it's a match before the donor passes, potentially?
Well, we know it's a match for him. It's just a matter of the donor passing away in an
Okay.
appropriate amount of time that we can then do the procedure, look at the lungs in person. We already know it's a match by size, by blood type, and we know.
Otherwise, I wouldn't be here.
Yeah, that's
On
true.
paper.
Yeah, everything on paper looks good. The CAT scan we look at looks good.
Okay.
All that stuff meets our criteria.
All right.
Alrighty.
Yeah. Well,
Any other questions?
I'm looking forward to.
Yeah,
this
me
done.
too.
Yeah.
I hope. All right.
I mean, it's unfortunate that someone has to pass, but
I know.
it's amazing what you guys can do, just to be able to give somebody else another life.
Yes, it is remarkable. We're grateful to be able to do it.
Yeah.
So hopefully we can take care of you tonight and get you breathing better. Okay.
Thank you.
All right.
Thank you so much.
Any questions? Dominic.
Dominic. Okay.
Dominic Mania.
Okay. All right, Dominic.
All right.
Yeah.
Okay, perfect.
All right. I'll see you guys later then. Okay.
Hey, yes.
All right.
Thank you.
Hopefully we'll see you in the
Hopefully I'll see you in the operating room.
Yeah.
I'm itching to see you in the operating room.
All right. Thanks for stopping by.
Yeah, my
Thank
pleasure.
you.
Door closed?
Yes, please.
Yes.
All right.